Good afternoon. We are live from Washington, D.C. How are you, everybody? I'm here with a couple of people that I like really much, and they're doing amazing work for children. The first person is Dr. Maria Acosta, and she is the clinical director for neurology at the Children's National Health System. How are you, Doctora?
Fine, thank you. Thank you so much for having me here.
The second person I have here is Ashley Nolan, and she's the Assistant Director for the National Health System, Children's National Health System.
Exactly. I work at the Hospital Foundation.
It's a mouthful, but we got it. In a couple of seconds, we're going to be joined by Eduardo Hill, who is a digital content strategist, and there he is. How are you, Eduardo?
Hello, hello. I was waiting for the link.
And on our chat room, we have Julie Diaz-Asper, who's going to be taking your questions. And I apologize because we are a little bit late. We were having a couple of technical difficulties to start, but so I'm going to go right into our conversation. Our conversation today is going to have to do with the Children's National Health System, which is a pediatric hospital in DC, and they are leaders in innovative treatments for children's illnesses. Right now, they take care of about 300,000 children. This was for last year. And out of those 300,000 children, 55,000 are Latino children. And so, you know, it's children who have different illnesses like cancer. Some have terminal diseases. But the doctor and Ashley and Eduardo are going to be talking in more detail about what the center does. You know, we're going to be discussing all of the stuff that the hospital does. So let's start talking about the situation for Latino children in general. Can you talk to me a little bit about the most pressing health issues that Latino children are facing right now? Who wants to go first?
Okay, I can comment a couple of things. I am a pediatric neurologist that works in this institution since 15 years ago. I am original from Colombia, and I see a lot of Latino patients, especially because I speak Spanish, and they are very close to my culture and my background. I think that the Latino population face the same medical problems that other populations face in this country. Unfortunately, we don't have statistics about the specific problems that are different for this population compared with the rest of the population. That is also something important and is part of what we want to bring to the community to better understand what are the specific and more common problems for this population. As you said, probably 25% of the patients that we see are Latino, and there is no big difference in terms of the diagnosis. I think that probably is big difference in terms of how to approach the treatment, the management, and recognize the differences between the cultural background, beliefs, and our Latino culture as a part of the treatment for these families.
Mm-hmm. And in your experience, doctor, I'm going to continue down that train of thought. What do you think are the barriers that Latino parents have in terms of getting care for their children?
I think that access to the care is one of the difficulties, and when I say access to the care is understanding the difference between the culture and the system in our countries and here. I sometimes put the example that I am a physician, I am a mother of 3 kids, and it took a lot of time and effort for me to understand how I relate with my pediatrician in a different way that I used to do in my country. When to call, how to approach them, what are the communication systems, what are the regulations, the legal implications of taking care of our kids. In addition to that, coming to a different country, you really need to build trust and understanding of the environment. And many of these are very busy parents that hardly have time to dedicate with that. It means that this is something that the care providers and the institutions are working very hard to provide that bridge for the access.
hmm And we have heard about the fact that historically Latinos lack health insurance, right? So that must have been a major issue for people in terms of accessing care. Do you have any statistics about that, Latinos and health coverage?
I don't know. I can tell what is my experience, and I really think that for children, the majority of the kids are covered by the insurance. But probably the main problem is not the coverage, is the access to the system. It means this kid has the right and the opportunity to have the best medical care possible, and sometimes they don't know how to access. They don't know how to approach and how to find the right expert in their problem. They are busy. They ended many times coming to the emergency room for things that in this country are not treated in the emergency room like maybe we do in our countries. And of course, the chain of care is broken at the point that despite they have the best opportunity, they cannot take proper advantage of that.
And now, Ashley and Eduardo, I want to talk a little bit about what the health system does, your national children's national health system. Can you talk a little bit to that?
Sure. So Children's National Health System specialists are experts in pediatric care. It's all we do here at Children's National, and now there are even locations here in the District of Columbia, but also Maryland, Virginia, and our physicians and all of our caregivers really take a team approach to caring for children within those communities. And we've been doing so for more than 140 years. If you can believe it, Children's National has been serving the nation's children and is one of the nation's top NIH, the National Institute of Health, funded pediatric institutions. So as a nonprofit hospital, we rely so much on philanthropy to provide this continued world-class care to every child in the community. And it's because of our generous supporters and because of people in the community that we have been able to provide that same level of care and innovation in treatment that you just mentioned. But that's what really my role is here at the Children's Hospital Foundation, is to ensure that continued care. And
so, and how do you think, given what the doctor was saying, you know, in the fact that you take care of so many Latino children in your center, how do you think that Children's National best tackles all of these issues that the doctor was talking about, like access to care?
Sorry, can you repeat that? I broke up for a minute.
Sure, I'm sorry. How do you think that Children's National tackles the issues, like the ones that the doctor was talking about, you know, the issues of access, especially for Latino kids?
Sure. Well, it is the policy of Children's National Health System to treat any child in an emergency situation, and the hospital, you know, really works with families on a case-to-case basis.
Well, I'm going to show. I want to show a short video. In the meantime, if you want to talk to me, doctor, especially while I set up the video, if you want to talk to me a little bit about some of the children that you have been able to get in touch with and to help in the center.
Okay. I really have a lot of opportunities to interact with patients from all the countries. And as I said, I see many children that are Latino, they're from the Latino community, especially for the fact that I speak English. Sorry, I speak Spanish, sorry. I speak English too. And it's interesting see there are many families, like for example, families that comes from Central America that are very hardworking parents. That I remember when I was in the ER, a patient that came to the emergency room with ear infection at 3 a.m. in the morning, and everybody was kind of like, "What, you are coming at 3 a.m. in the morning for an ear infection that can be treated by the pediatrician?" And we all were kind of, why they are doing here. Talking with the family, it was very simple. The parents have to work 2 full times. they don't have the time to communicate to each other, and they only realize that the kid has an infection at that time in the day, and they needed the solution to the problem before the next shift for them to go to work. It means that instead of taking a rest, they need to bring it to the hospital. I mean, this is one of the things that I mentioned in terms of the communication of the providing care, that probably if this family has a better information about how to approach the pediatrician, they would not end up in the emergency room sacrificing their time to rest. They probably would have other sources to provide the care that is not for an emergency room. That they are teenagers. I love teenagers. It's very interesting to see the difference between generations, between the parents that comes from our Latino countries and the kids that are here, and the difficulties and the struggles that many parents have in terms of communication, because they speak only Spanish, the teenagers only want to speak English, and of course it's like a mix of feelings, yes, and how to handle that situation. Those are some of the examples. A patient that wanted me to call the pediatrician in El Salvador to explain what I wanted to do before that she could feel comfortable doing that to their kid. I mean, that's some of the stories that I really think that are interesting.
No, and that is why the help that the Children's National does, the work that you guys are doing is so so helpful and so amazing, because you are really covering a segment of the population that really needs your services. So I'm gonna show the video about what you do, and I gotta say I've seen this video and it's very inspiring to see. Let's watch.
We begin every day, every case, every new idea with a question. What's right for children? What's right for the youngest, the most vulnerable, the most resilient? What's right for a future engineer, a rock star, a princess, a president? We believe what's right means that every child should be cared for by people who have devoted their careers to children's medicine. Whether in the OR, in the community, or in our hospital, you'll find them. Nurses, surgeons, researchers, educators, all with a lifetime of expertise and commitment. What's Right is a special place designed with kids in mind, a place focused on their unique physical and emotional needs, where some of the world's most innovative thinking is working to reimagine children's healthcare, where moms, dads, and siblings are as much a part of the care team as we are, and where lives are saved and lifetimes reclaimed. What's Right means raising a voice for those who cannot, championing the health of children in the nation's capital, across the country, and around the world. Working so that every child, everywhere, has the best chance at a bright future. We are Children's National. Children's medicine is not part of what we do, it's all we do. Every day, we honor a mission that goes back a century and embrace a vision that goes forward just as far. We are protectors and guardians, stewards and advocates, visionaries and leaders, working with a single focus: to bring health and well-being to all children. We don't believe it's unreasonable, unrealistic, or unreachable. We believe it's just right.
Wow. Wow, it really shows, you know, it puts in perspective the work that you're doing. These children are so precious, and it's amazing to see that you are helping the children that need it most to have a healthy future. So let's talk a little bit. I know that you have a new initiative going on right now, and I would like to know a little bit more about the initiative and why you set that initiative in place. I know that the health system needs a lot of help right now. Ashley and Eduardo, can you talk to us a little bit about that initiative?
Absolutely. So you're right, Eliane. We have a new program here at the hospital called Milagros Para Niños. And the core of this program is really engaging the Latino community in Washington, D.C. to raise funds and build awareness of this amazing organization that you just learned a little bit about. And the idea actually came from a peer children's hospital, which started a Milagros Para Niños program in 2010 that has been so tremendously successful in bringing together the community and bringing in a really strong, dedicated group of Latino leaders to kind of lead the charge. Eduardo is one of them, one of the members of our inaugural Latino Advisory Committee. And kind of all of our efforts and all of the passion for this cause is coming together in our first fundraising event next Friday, May 16th at 10 a.m. We're hosting a Celebrating Our Mothers breakfast with the Mexican Embassy at the Mexican Cultural Institute. So we're very excited about Milagros, and I'll let Eduardo share a little bit more with you as well.
Yeah, so for all the great reasons that we've heard, as Ashley mentioned, and we have powerful reasons to take action. So on May 16th, as she mentioned, we are hosting our first event, and this will be at the Mexican Embassy, the beautiful building they have called the Cultural Institute, beautiful landmark in this town. And we're coming together to launch Milagros Para Niños awareness and fundraising program with the hopes of informing, educating, and inspiring our community to get involved, to raise awareness, and frankly, to raise the critical funds needed to advance this great cause, right? So we expect about 200 people, including some distinguished representatives from some of the embassies, Mexico, Spain, the ambassador of El Salvador will be there. We have 2 MCs, not one, Pedro Biaggi from El Sol and Cindy Peña, a reporter in town.
We love that.
So it'll be a celebration of Latino culture with Latino themes and flavors, and we're going to honor one patient family, one community leader, one caregiver. Then the chief medical officer of the hospital will give a keynote address, expanding on the great work they're doing. And like I said, lots of Latino flavor to go around. We'll have a live mariachi band.
Oh, wow.
Yes, so much fun. They are a good time. They are a good time.
Can't go wrong with mariachi.
No.
And not just mariachi, mimosas and amazing colorful food from our countries, and all to create a memorable cultural educational experience that will help us launch this program and raise a lot of funds to help a lot of kids, because that's what we're about. So May 16th, we're very much looking forward to it.
Awesome, and definitely sounds like a lot of fun. You can't go wrong with mariachi, like I said before.
No.
And if you add it, the guacamole, I'm there.
Absolutely.
Just to add one thing to what Eduardo was saying, why these funds are so critical, and it's because Children's is committed to a holistic approach to care, and many of the services that are vital for physical and emotional healing and support, those aren't covered by insurance, and that's why the Children's Hospital Foundation is so important, and why Milagros is so exciting. And we do hope to see you there next Friday on May 16th.
I just wanted to comment about the same thing that Ashley is saying. Is like the health care will cover the medical care for the disease, but having a sick kid is a traumatic event for a family. It's something that requires, as a mother, I want to be sure that I can take care of the rest of my kids, that I can be sure that my kid is well taken care in the hospital, and that implies a lot of resources that only a children's hospital, and in this case, Children's National, is thinking together not only about what is the medical treatment that the kid needs to have, is what else this family needs to move along in this traumatic situation. Moms need to work, need to take care of other kids. How we are going to be giving peace of mind to this mom that while the kid is here in the hospital and she go and take care of other kids, she will be safe and comfortable with that decision. How we can make that this kid, despite of the difficult treatment that he's facing during the time in the hospital, is also having some fun, having friends, getting ice cream if the doctor permits, having a teddy bear, having somebody with play, etc., etc. And all these things are going to be important to provide, because it's not only the pills or the treatment that the kid is going to receive during that time. And in addition to that, it's also to promote research in our Latino community and what are the conditions that we need to explore better in that population, how we can serve that population that is growing every day in this country, and that is going to be probably a minority in short time, is because we are growing too much, that the future of this country is going to be very fundamental, supported for the Latinos.
Yeah, well, this is why pediatric care is so important, right? We do have more children than other ethnicities, so not to go to the stereotype, but it is a big part of our community, as it is food and celebration. Food is kind of like the center of our social life, right? Wherever we go. So I want to know, because I love the name of this program, Milagros, and Milagros Para Niños. Where did the name come from? Where did the idea come from for this?
So the idea did come from one of our peer children's hospitals in the Northeast that had this really successful program, and I've had the great pleasure of working very closely with them to share ideas and exchange best practices about how do you recruit the right people to lead this initiative, and kind of how do you want to draw these people together, and how do you engage the community to care, and that's really where the idea came. And Milagros, is what happens at Children's National because of our world-class physicians, because of the innovative treatments. That's what it is to be a milagro.
And to our gringo or non-Spanish speaking viewers, Milagros means miracles, and this is what these amazing people are doing for children. Now, Ashley, I'm gonna go back to you again, and I want all of you to contribute to this, because Doctor, you work at this every day. Why do you think Children's is the best pediatric healthcare provider in the country?
Gosh. Children's has been recognized for years for its expertise and innovation in pediatric care, just on a national level. Dr. Acosta, maybe you can speak a little bit more in detail about why you think, just since you're...
Well, I think that it's a hospital designed for children and for children. All that we do here is children medicine. It means everything that we do has to have the components of the medical treatment, but also the less traumatic event for the family and the children, but also looking forward to the future of the medicine that we are providing. And the hospital has the support and an extensive research program specific for children, for many diseases that are different how they're going to behave in an adult than a children. And I think that we all physicians now is very clear that children are not little adults. Probably adults are bigger children. Better than that. Yeah, but it's a different component. Children, we need to account for the developmental aspects of every age, every situation. Every condition can be so different at different age that we really need to account of that. Medications has different metabolism, etc. I mean that having a specific program that is focused in children is very, very important to be sure that what we are doing is the right for the age that we are treating. And we treat kids from the newborn, even sometimes even in utero, to at least 21. I mean that you can see how big is the window of the age and the variations that can occur.
And what kind of treatments can a family get for their children when they come to you, doctor, when they come to the health system?
Oh, any kind of treatment. It means we have from outpatient services. As Ashley mentioned, we have like a lot of locations around the Beltway and around the area, from Virginia, Maryland. We also have like recently an Eastern Shore telemedicine that we are trying to connect for even those communities that are a little bit farther away, that we can provide those services. We have an inpatient services in the hospital for any admission that goes from little stitches in the ER, from surgical treatments, brain tumors, cancer treatments, neurosurgery treatments, transplantations, you name it, anything. I really don't think that is not any area in the children medicine that is not covered in this hospital. I may be wrong, but I really think that is almost all the front areas in all the specialties that are covered in this institution.
And Dr. Acosta, you're absolutely right in that we probably could go on for another hour or hours talking about all of the different expertise that are covered at Children's. And I was just going to add a few that I know have a high volume of Latino patient families, and that would be our Diabetes Care Complex, our Obesity Institute. There's a high number of children with heart disease, so in our Cardiology unit. So that's totally another hangout that we could go in depth there, but
I'm sure, especially, you know, so many studies have determined that Latinos have a propensity to develop diabetes and heart disease. It's one of the main killers for our community. And so it's amazing to hear that the hospital can provide that peace of mind for parents in terms of preventing some of these kind of things. So is there anything that a parent can do to help their children kind of not wait until the child is sick, but to do preventative steps in terms of these kind of diseases?
Oh, a lot. I think that the parents can do a lot in this portion. I think that medicine is moving to the preventive better than the treatment. And I think that this is also something that the hospital is trying to, is doing. It's not trying, is doing a lot of education for families and for the community. The obesity clinic also has, for example, a lot of education about healthy eating habits, exercise, other type of interventions. I want to mention the pain clinic. It's really, really, really a fascinating program that the hospital have. As you can imagine, pain is something very complicated to treat, and you realize the restrictions that many medications can have. The pain treatment in kids is really complex and has developed an amazing amount of opportunities for treat patients with chronic pain in the pediatric population. I really think that this is an amazing program, probably few of them in the country, so complex and so oriented to children.
Nice. And we all know, I mean, I'm a parent, I have a daughter, and there's nothing more agonizing than seeing your kid in pain, right? I mean, it's something that gets all of us desperate as parents, and so it's great to see that the health system provides that kind of service. I would like to go back again to talking about the event coming up, because the funds for that event are so critical in terms of continuing to provide these kind of services for parents in the center, and specifically for Latino parents. And so, and also the main point of these conversations online is to do something about it. You know, it's not just yapping and getting to know you, although it's like very nice to have you here. But also, I would like to prompt the community to participate in these kind of things and to actually contribute and become involved. So what can somebody become involved in either in the program that you're developing, the Milagros Para Niños, or in contributing to the Children's Nationals in general?
Sure. So with Milagros, you know now that we have our first event next Friday, but beyond the event, there are so many opportunities to engage and be a part of what we're doing and make a difference at the hospital for local kids. So our next opportunity after Friday, May 16th, will be to join us on Team Milagros at the Race for Every Child. This is the second annual 5K and fun run that the hospital has put on. It is a hugely, hugely attended and fun day for the family, and we invite you to join Team Milagros and walk or run or jog or skip the 5K and fundraise with us. It'll be a really fun time. We will include follow-up information with my contact so that you can reach out, but anyone is welcome to send me a note at Nolan, Nolan, @cnmc.org.
Cool. And what about the breakfast for people who are interested? You know, I don't want to miss out on the mariachi and the guacamole. So how do I get involved in the breakfast?
Yes, so the website is a little long, but I'm going to spell it out for you. So
Get your pen out.
Yes, so it's first year. Next year we'll have something a little more compact. helpmakemiracles.org
Okay.
/event/milagros.
Okay, and Julie can if you can please put it on the comment section so that people who are viewing can also take a look at it. So what would you say to somebody who who decides we're talking here, and of course we're all a little bit invested in this, as part of the committee. For example, I'm very invested in making this a success, and as are all of you. But what would you say to somebody who views this and says, that has nothing to do with me, and why do I have to care about this? What would you say to somebody like that?
Well, my first reaction would just be that we can never know when the need is there for us to go to Children's National. We don't know if it's tomorrow or next week or 10 years from now, but in this area, there's, you have friends and you have coworkers and your family and neighbors. It could be their child. It could be, your sister's children. And Children's National really does have a footprint across the Washington, D.C. area and beyond. So I would say to them that this is a tremendous opportunity to get involved in supporting local kids. And you do never know when the need will be there. A couple of months ago, I brought someone for a tour for the hospital, and just the next day, they were there unexpectedly. So it is true. You never know.
And if I can add, Julie and Ashley, they've put together an amazing committee of local professionals in town, covering almost every area of professional, functions in the marketplace. And none of us are health specialists, with the exception of the actual doctors, but all of us have professional skills, and all of us are part of we have friends, we have a network, so all of us can contribute. That's really just the starting point. That's all you need, is just being in this city and you have a network of friends. You can get going, you can influence, you can help get the ball rolling, and that's what they've done very effectively. They will also give you a tour of the hospital. I personally went and did the tour and got to experience firsthand. Of course, that takes a little scheduling and takes some time, but it can be done if you want to really see what's happening. And that is, I'll tell you, that is an experience. You will, we can tell you all day, but until you walk in there and see the children and see the facility, and that's when it really impacts you. So, again, great congratulations to Julie and Ashley for what they've done. It's a privilege to be part of this, and you know what? It's a lot of fun. We've had dinners, we've had Cuban dinners at Julie's house. So it's fun for a great cause.
Awesome. I want to add something. I would say take the opportunity to pamper yourself. Go to the breakfast. It's a great breakfast. It's a wonderful food, wonderful setting. you will have a very cheap breakfast for the quality of what you are going to get. And then, in addition to that, you will meet wonderful people, and you can feel by yourself what is this all about. And then you can take the decision if you want to stay or not. And if you say no, at least you enjoy a wonderful setting with wonderful food and with wonderful people. But I bet that many people will feel in love with the cause after being in this environment, because as Eduardo said, it's a contagious environment. It's fun. It's great to be with all these great people sharing the same interest in a very novel cause.
And if you can't make it next Friday, it's okay. You can still make a donation on the website, or you can join us in September at the Race for Every Child. So there are many opportunities to get involved in Milagros and the hospital at large. So we're excited to meet you.
What is the date for the race?
The date for the race, I don't want to misspeak.
Okay, but in September.
About what date it is. It is in September, yes.
September 13th?
I believe it is September 13th. I don't have the date right.
So we'll post it on the website. And,
we will post it.
People get the right information. I must say that for me in particular, to add to what you all already said, which I wholeheartedly agree with, I think for me in particular, getting involved in something like this is, one, I'm a mom, and even though my daughter doesn't need pediatric services anymore, but I do have family. I have nieces and nephews, and and people that I love very dearly, who are my friends, who have children, and I see the desperation. I have felt it myself of having a sick child. So I can definitely feel the pain of so many parents out there, and see the joy when they find a place where they can come and get their children healthy again. So, I urge all of you to please, participate in this in any way that you can, either online or participating in the breakfast or in the race. However you can do it, every little bit helps. And I'm going to give the floor to all of you to say, any last words that you want to say to people.
Thank you so much for taking an hour out of your Tuesday afternoon to hang out with us and learn more about Children's National and what we're getting started with Milagros Para Niños, Miracles for Children. We're really excited to meet you. Thank you.
Thank you. Anybody else? Jose?
Well, thank you so much again. This is a fantastic opportunity, and hope you guys to come here. Anybody that wants to look at what we do at Children's Hospital, contact Ashley. We will be more than happy to show. We are very proud of the work that we do here, and we just want to make it better for everybody.
Awesome. Eduardo?
Yes, so thank you for the opportunity. If you like Cinco de Mayo, just wait for 16th de Mayo. Join us then.
Awesome. And I know Julie is very excited too, even though she's on the chat room. I'm sure she's chatting up her way, why she is involved in this too. And so I want to thank all of you. Thank you, Ashley, so much for being here. Thank you, Eduardo. Thank you, Dr. Acosta. I know that you have a lot of patience and you took this time to be with us, so I appreciate that very much. Thanks to Julie for manning the chat room. As usual, you are amazing, and I love you, my hermana. And I'm going to see you all next week again. You're going to be able to see this hangout again on my YouTube channel, which is youtube.com/user/Elian Ramos, and I'm going to be tweeting the links on Twitter and everywhere else, and I see you next week. Thank you so much, and please help Milagros Para Niños.
Thank
Ciao.
you.
Thank you, everyone.
Adios.
Hablamos pronto. Bye.
Bye. Bye.
Bye.